Hello, my dear viewers. Welcome back to your health channel. It's Sri Lanka Health Podcast. I'm Dr. Prabhat. Today, I would like to discuss about a, another cause of chest pain, which is called pneumothorax. And first of all, I would like to remind you again the same thing I've been talking about chest pains, which is common to every video that I have discussed with any cause of chest pain. That means chest pain should be assessed by a trained healthcare personnel, and it's not for you to self-diagnose and treat. This self-diagnosis can be dangerous. Therefore, this video is only for your information and improve your knowledge. Okay, coming back to the topic, I'll quickly explain what is called pneumothorax. In your lungs, there is a central part which is made up of lung parenchyma, made up of alveoli for gas exchange, both lungs, and separately right lung and left lung. Each lung is covered by a tissue sac which is called pleura, and it is a covering of the lung. And if you just think this is one sheath of pleura in my left side of the chest, in the lung, and this is the chest wall including the ribs, and in between the chest wall and the pleura there is a gap which is called a pleural space. If there is a leak like this from the pleura, air can come into the chest wall and pleura in between into the pleural space, and this is called pneumothorax. This can be life-threatening, and the causes for pneumothorax can be multiple. It can be traumatic, can be a rib fracture causing rupture of the lung and leaking of air into this pleural space and causing pneumothorax. And the other possibility which we commonly see in acute medical setup is spontaneous pneumothorax. Okay, who are the people at high risk of developing a pneumothorax? Tall, thin people, maybe young people, and who have a family history of pneumothorax are more prone to get this problem. Again, pneumothorax is trapping of air in between the lung and the chest wall, which is called pleural cavity. They can develop spontaneous pneumothorax. And other group of people are the people who are smoking. The smoking is a risk factor. Okay. The first group of people they have talked, usually younger age group, and people who develop pneumothorax due to smoking and chronic lung disease. It's elderly group. It can be categorized to the second cause for pneumothorax. Okay, what are the symptoms of pneumothorax? Oh, I have chest pain suddenly. I can't breathe in. That's the symptom. It's a sudden onset chest pain in one side of the chest where you can't breathe in, and each breath causes a severe pain, and even you have to limit your depth of the breathing, because at the end of the breath you will feel some pain which is severe in nature, and you will feel something like rubbing on two surfaces, and you feel that kind of pain in this affected side of the chest, right? That is called pleuritic type of chest pain. As I explained before, pleuritic type of chest pain can occur due to various causes, and pneumothorax is one cause for pleuritic type chest pain, right? And what are the possible consequences of pleuritic chest pain, or coming back to pneumothorax? Okay, as I said, when this tissue space, the pleura and the chest wall, when air starts trapping, this space can get increased because lung can collapse and lung can become smaller and smaller and smaller. The trapping air become bigger and bigger, and lung is the organ which contains tissue for gas exchange. When it is collapsed, it can't exchange any gas. And other thing is, when there is air collecting in the chest wall space, just in between the pleura and chest wall, then it will put pressure onto the lung and it causes collapse. And when it get worse, it can put pressure into the heart, which is close proximity to the lung, and great blood vessels of the chest like aorta and pulmonary artery. And also it can push all these organs from one side to the other, and this can cause a block, and this can cause obstruction to the blood flow and airflow, breathing. Therefore, when this kind of thing occurs, it is called tension pneumothorax, which can cause sudden onset respiratory and circulatory collapse, and which can lead to sudden death. Therefore, if you get this kind of chest pain, go to A&E, call your doctor, or call for emergency medical assistance. I think it's clear, but anyway, if you have any queries, you have the comment section. I'll be there to reply you. Okay, see you in next video. Bye bye.